What are the different types of healthcare rationing? Have you ever wondered how healthcare resources are allocated when there simply isn't enough to go around? This question is at the heart of healthcare rationing, a topic that raises ethical and moral dilemmas. Let's break down the different types of healthcare rationing and how they fit into the framework of situation ethics and philosophical ethics. Healthcare rationing happens when demand for medical services exceeds what is available. This leads to tough choices about who gets what level of care. There are three main levels of rationing: macro, meso, and micro. Macro-level rationing occurs at the societal level. Governments and health authorities decide how to distribute resources across entire populations. This might involve setting policies that determine which treatments are funded. The goal here is to allocate resources fairly while considering factors like cost and need. Ethical principles like social justice and equity play a big role, ensuring that vulnerable groups are not overlooked. Next, we have meso-level rationing, which takes place within healthcare organizations like hospitals. Here, decisions are made about how to allocate resources among patients. This could mean prioritizing certain groups for treatments or managing waiting lists. Ethical frameworks guide these decisions to ensure fairness and transparency. Factors like the severity of illness and urgency often come into play. Micro-level rationing is where individual healthcare providers make decisions at the bedside. This involves determining which patients receive specific treatments. This type of rationing can be particularly challenging, as personal biases may influence decisions. To combat this, ethical guidelines and standardized criteria are often used to ensure fairness. Rationing can also be classified as explicit or implicit. Explicit rationing involves clear policies that outline how resources are allocated. This transparency helps build trust. Implicit rationing, on the other hand, occurs more informally, which can lead to inconsistent care and ethical issues. Criteria-based rationing is another important aspect. This involves using specific criteria to guide decisions. For instance, the focus may be on maximizing overall health benefits or ensuring fair distribution among populations. Sometimes, age-based criteria are considered, but ethical guidance suggests these should be applied carefully to avoid unfair discrimination. Practical examples of healthcare rationing can be seen during crises like pandemics. For instance, when resources like ventilators are scarce, clear guidelines are needed to ensure fair allocation. Organ transplantation also uses objective scoring systems to prioritize patients based on need and potential benefit. In summary, healthcare rationing is a complex issue involving multiple types that are distinguished by decision-making levels and ethical principles. The aim is to balance fairness and respect for human dignity while maximizing benefits. Understanding these different types helps us navigate the challenging landscape of healthcare ethics and morality.